Today we will learn about the anatomy of prostate gland. First, draw a U-shaped structure, then an arrow shaped inside it. Then you are going to draw a heart-shaped structure around it and double it. Then draw two wires, then a block. This is the diagram for prostate gland. So, what is a prostate gland? It is a pyramidal shaped fibromuscular glandular organ that surrounds the prostatic urethra. It secretes acid phosphatase, fibrinolysin, citric acid, amylase. PSA means prostate specific antigen, then prostaglandins, and these secretions form the bulk of the seminal fluid. It is located in the lesser pelvis, below the neck of the urinary bladder and above the urogenital diaphragm. The shape is inverted cone and its weight is 3 grams, width is 4 cm, length is 3 cm, thickness is 2 cm. Next we will see about the external features. It is divided into apex, base and surfaces. The apex is formed by the urogenital diaphragm, the base is formed by the neck of the urinary bladder, and there are 4 surfaces, anterior, posterior and 2 infralateral. The anterior surface is 2 cm behind the pubic symphysis and the posterior surface is in front of the ampulla of the rectum. The 2 infralateral surfaces are related to the anterior fibers of levator ani. And you have to remember this, the posterior surface is divided into smaller upper area and larger lower area by a transverse sulcus. Now we will see about the lobes. So there are 4 lobes, anterior, posterior, median and 2 lateral. I have divided each and every point and differentiated it. So first we will see about the anterior. The anterior lobe is also called as isthmus. It lies in front of the urethra and there is no glandular tissue present and it connects the 2 lateral lobes. The posterior lobe lies behind the ejaculatory ducts and it connects the 2 lateral lobes, and it is the most common site for the primary carcinoma of prostate. Then median lobe. It lies behind the part of the urethra and in front of the ejaculatory ducts, and there is more amount of glandular tissue present, and it is a common site for the formation of adenoma. There are 2 structures you have to remember there, uvula vesicae and urethral crest. Then 2 lateral lobes are present. It lies one on each side of the urethra. Some glandular tissue is only present, so the adenoma will be more common in older age. So let's see about the structures within the prostate. The structures are prostatic urethra, ejaculatory ducts, prostatic utricle. The supports of the prostate are urogenital diaphragm, 2 pairs of puboprostatic ligaments and retrovesical fascia of Denon Villiers. So there are 2 capsules for prostate, true and false. True capsule is formed by the condensation of peripheral fibrous stroma of the gland, and false is derived from the pelvic fascia. The true capsule is very closely related to the gland, while the false capsule encloses the urinary bladder and the prostate gland. Next we will see about the structure of the prostate. It has 3 tissues, fibrous, muscular and glandular tissue. The fibromuscular tissue together forms the stroma of the gland. The glandular tissue consists of tubuloalveolar glands. The lumen of those glands has colloid mosses called corpora amylaceae. The glandular tissue forms the parenchyma of the prostate gland. Histologically, we are dividing into 3 zones, outer, inner and innermost. The outer zone is the most common site for the formation of carcinoma of prostate, which is called as prostate gland proper, and the inner zone consists of the submucosal glands and the innermost zone consists of the mucosal glands. The artery supply includes the branches of inferior vesical artery, middle rectal artery and internal pudendal artery. The venous drainage, it receives from the deep dorsal vein of penis in front of it and above from the vesical venous plexus. It drains into internal iliac vein, vertebral venous plexus. Then the lymphatic drainage includes its drainage into internal iliac, external iliac and sacral group. Nerve supply includes for sympathetic superior hypogastric plexus and parasympathetic pelvic splanchnic nerves.